On August 29, 2005, Hurricane Katrina struck the Gulf Coast, leaving thousands stranded and in need of help. People like second-year emergency medicine resident Dr. Brian Martin and future LSU Health Shreveport Chancellor Dr. Robert Barish stepped in to help.
I had gone down with the fire department to provide some medical assistance to the fire department and the paramedics that were working down there. We had been tasked with evacuating LSU and Tulane Hospital, and we would make daily runs from Baton Rouge down to New Orleans to work on evacuating the patients out of there.
I was a member of the Maryland National Guard, and I was out at the time, and I got called by our commanding general to join what was called the Maryland Defense Forces, a professional unit that augments the National Guard, and we set up 6 clinics.
We weren't dealing with many injuries. We were dealing more with patients that were being moved out of the hospital. There was everything from minor injuries or illnesses to patients that had just had open heart surgery or brain surgery. You would never expect them to be leaving a hospital, but under the circumstances, there was no alternative. They used boats to get to the hospital, and they would evacuate the patients to a dry area where they would then be loaded into ambulances and transported to wherever they needed to go.
A lot of the issues that we faced were one of mental health. People had no way to communicate. They had no way to get their medications. So a lot of what we did was basically primary care, and that was what was needed when we were in New Orleans.
Many evacuees ended up in Shreveport.
I played a behind-the-scenes role. When the evacuees came from south and came into Shreveport, and began to go into the shelters, many needed medical attention. Although there was a huge outpouring of support, there wasn't any coordination to best utilize the resources. And we organized a collaboration system on one of our servers, one of the university servers, that would allow individuals to go into a website and schedule themselves to work at the center.
Even weeks after the storm, New Orleans was struggling to survive.
There were no lights in the city. We have to had emergency generators where we were in the hospital where we were billeted. And so the area was really devoid of communication. I remember I never heard any birds. Wildlife was absent, as I recall. It was very hot and humid. People were completely cut off from the outside world. There was no way to communicate. And what we found was we were the source of communications for many of the patients that we saw because we had our own command center, communication center.
For rescue workers, Hurricane Katrina was unlike anything they had seen before.
I spent 3 months at the World Trade Center for 9/11, and it was completely different than Katrina. There was so much need with Katrina that just wasn't present with 9/11. Even the initial phases, there weren't as many survivors from 9/11 as there was in Katrina. So we were definitely overwhelmed with needing resources.
A lot of the places I've practiced were really rural areas in Africa, on the border of Cambodia. I've done some missions in Honduras. So I've been into a lot of places in my life, but a lot of those were more rural areas, but I never seen the devastation of one of the major cities of the United States in my life to this extent. And so many of us never thought the city would come back at the time that we were delivering care. And so to see it come back in a way it has over the last 10 years is really remarkable.
During times of disaster, it's amazing how humanity comes together to help everybody. Strangers taking in refugees from Katrina to help them. It's really enlightening to see the good in people.